Our default button in medicine is to go ahead and keep doing everything we can do to sustain life, and that's correct. But not everybody wants that approach to their end-of-life care. What WyoPOLST is, it's a form that documents the conversation held between a patient and a provider, talking about their goals of care as they approach the end of life.
This is a medical order that is signed by a provider, and it is the wishes of the patient, and so yes, by law, these are to be followed. It's an order from a provider, possibly outside of the medical staff there, but by law, the accepting providers have immunity to follow this without risk of following an order from somebody that's not on medical staff.
The main benefit is for the family, is that they can feel that after having a discussion about what their loved one's wishes are with their loved one present, they can feel very confident that they are fulfilling what their loved one's wishes are. Before we had WyoPOLST, we didn't have a uniform way of documenting what patients wanted at the end of life. Now we have a form that helps frame a discussion.
So I've been very surprised that patients have been very open, very receptive to the form. In fact, I've had couples where we've been doing it for the patient who maybe is in their last year of life, and the spouse will say, gosh, I want one too, can I get mine filled out? It may be not where it's appropriate for them yet, but I think they've been very open, and it really kind of just gets the monkey off the back. They want to have that conversation.
This is different from an advance directive because it is a doctor's order, and it is actionable within the medical system. It is appropriate for EMS, and it's about the care the patient wants right now, not sometime in the future.
WyoPOLST form should definitely, a copy should definitely be with the patient's primary care physician, as well as whatever local hospital that person may potentially end up in.
We are asking patients, when we complete the form, to hang the bright yellow form on the refrigerator that will tell the EMS what level of care that patient is wanting.
This needs to be part of what you do, not only for the benefit of your patients, but for the benefit of the providers around you, so that we know what your patient wants and what you want. You're the one who knows your patient. You've had these conversations. Don't let us guess at 2 in the morning what you and your patient want.